Understanding Human Metapneumovirus, HMPV. HMPV, a single-stranded RNA virus from the Paramyxoviridae family, discovered in 2001. Causes respiratory tract infections, especially in children, the elderly, and immunocompromised individuals. Global presence, seasonal peaks in late winter and spring. Second most common cause of lower respiratory tract infections in children after RSV. Symptoms: fever, cough, nasal congestion, wheezing, and in severe cases, pneumonia or bronchiolitis. Spread through respiratory droplets, close contact, and contaminated surfaces. Targets ciliated epithelial cells in the respiratory tract, causing inflammation, edema, and mucus production. Similar pathogenesis to respiratory syncytial virus, RSV. Hand hygiene, regular washing with soap and water or use of alcohol-based hand sanitizers. Respiratory etiquette, covering mouth and nose while coughing or sneezing. Isolation, avoiding close contact with symptomatic individuals, especially in healthcare settings. Frequent cleaning of surfaces in healthcare facilities and daycare centers. Adequate ventilation in indoor settings. Currently, no licensed vaccine for HMPV. Ongoing research on live attenuated and protein-based vaccines. Immunocompromised individuals, elderly and infants. Enhanced preventive care like avoiding crowded places during peak seasons. Mainstay of treatment, as no specific antiviral exists. Includes hydration, oral or intravenous fluids to prevent dehydration. Antipyretics, paracetamol or ibuprofen for fever and discomfort. Oxygen therapy for hypoxemia in severe cases. Hospitalization for infants, elderly, or immunocompromised individuals with severe disease. Mechanical ventilation or high-flow oxygen for acute respiratory distress. Ribavirin, limited evidence of benefit, not routinely used. Monoclonal antibodies, research is ongoing for HMPV-specific monoclonals. Bronchodilators, occasionally used in patients with bronchospasm, though evidence is limited. Corticosteroids, controversial and not routinely recommended. Co-infections with bacteria or other viruses like RSV require targeted therapy, for example, antibiotics if bacterial involvement is suspected. HMPV is a significant cause of respiratory infections with no specific treatment or vaccine available yet. Prevention focuses on hygiene, isolation, and environmental controls. Supportive care remains the cornerstone of treatment. Development of vaccines and effective antiviral therapies holds promise for reducing the burden of HMPV.